special time to be in healthcare. And it's really rare when any generation has the ability to impact the field that they're in the way we all actually do at this moment in time.
Since 1944, the South Florida Hospital and Healthcare Association has offered a cooperative forum for healthcare providers and community leaders to address the issues of the day. Today, the association seeks to be an advocate, facilitator, and educator for its members and a voice for improving the health status of its communities.
Not many metropolitan associations have survived through the transition of the past 25 years, but under the good leadership of Linda for the past 15 and George Birch prior to she, Sarah Grimm is an interim between the two of them. We've had good leadership and it's provided good service to the hospitals in South Florida.
My first year we had the big 50th anniversary party, and it was the kind of golden opportunity, I think, to cement some of the issues and opportunities to expand. One of the big things that we did in the 90s was add non-hospitals to the membership, and some of the hospital people came to that sort of kicking and screaming, but I think that now they recognize the added value that having other healthcare industry partners as full members of the organization means.
I've seen the association grow from when it was just the Hospital Association to the Hospital and Healthcare Association, and really try to expand its role, its place to not just be hospitals, to try to address the entire healthcare system here in South Florida.
Very valuable asset to the community and also to its associate members like myself as someone working in an architectural firm, but also valuable for the hospitals.
It becomes an industry organization as opposed to just an institutional organization.
The association promotes a broad dialogue between its members and elected officials, educators, the business community, the media, and the public, as well as legislative advocacy.
Heather Rohan is the chairman of the association. Anthony DeGina is the vice chairman.
Well, what the organization does, it provides a venue for all healthcare providers in our area in South Florida, all the way from the Keys up to the Treasure Coast, to have a way to come together in order to address the issues and the challenges that face all healthcare providers today.
They've been a way to facilitate discussion about policy issues that are coming down both nationally and regionally that are important to health organizations. And they're always on the cutting edge in terms of bringing people together who understand the various aspects of healthcare and allowing a forum for them to discuss these kinds of issues.
We speak on behalf of the members to elected officials and to the public. A lot of media work representing our members to the papers and the television stations.
The association focuses really on the issues directly relating to South Florida and has been a very strong advocate from a political standpoint to lobby as necessary for the needs of the South Florida healthcare market and ultimately for our patients and our community.
In addition, the association provides shared best practices, cooperative community planning, and educational programs.
And here's what I'd like to cover with you, some of the key strategic issues relative to healthcare reform.
The way we have benefited is through education, also about learning about public policy issues. As you know, healthcare is in crisis, and we have to understand the problem before we could come up with a solution to the problem.
We need comprehensive healthcare reform, and that means we need to cover all Americans. We need to improve the quality of care, and we have to reduce costs, and those are interlinked.
The association continues to grow a cross-sectional community together, 300 to 400 people, talking about these type of subjects that we're going to be discussing today.
One of the most important aspects of the South Florida Hospital and Healthcare Association are the dynamic networking opportunities, like the annual golf tournament.
It's a great day, the weather's great, pars and birdies we hope.
The networking opportunities are tremendous. Today is a perfect example with the golf tournament. It's a fundraising opportunity, obviously, for the organization, but it's also a very good networking opportunity for both hospitals and for vendors that may seek to do business with those hospitals.
A lot of deals are made on this golf course, and I made some really good connections today.
It's been very rewarding. They do a lot of good things for the industry, and I'm glad to be able to participate and help a little bit.
I'm golfing today. I'm out selling raffle tickets to a lot of these guys that I know and do business with. And also I'm here to build relationships, new clients, new business.
The South Florida Hospital and Healthcare Association continues to strive to bring value to its members.
First of all, the networking opportunity, you build relationships, develop friendships, but really the business opportunities to look at the bottom line effect that an association like this can have on the cost structure of our hospitals is what drives us to be a member of this organization.
South Florida is an area of the country that is very diverse, not only in the populations we serve, but in terms of the folks that serve them. The number of hospitals that are competing with one another are unlike anywhere else in the country. A lot of different systems, a lot of different hospitals, and the association has been very effective in just bringing us together, having us sit down and have dialogue over those issues that we can have conversations and discussions, and putting together common agendas that can better the health of South Florida.
There have been a lot of individual projects funded by the hospitals, not only for the members, but sometimes for more than the hospitals throughout the state. Some political accomplishments, but I think the biggest accomplishment is the ability to sit down with your competitors, but have common issues that you can discuss and work together to solve those issues.
They streamlined the processes by which hospitals generated procedures, policies, took us through crises in the healthcare environment, was there as a valuable resource to hospitals.
It was the coordinative entity that brought us through Andrew. We needed an association to bring us back together. We needed a coordinating agency to know who was up and who was closed and who had beds and who had doctors and where patients were and where supplies were. And you know, it could not have happened better had it not been for the South Florida then Hospital Association. My hospital, Mercy Hospital, closed for 4 days and had the unique experience of having to bring a large hospital, a large acute care hospital back online when everybody who worked there, their facilities, their homes, and their families were disrupted. And again, the work of the association was able to give us the necessary resources and information to get back online.
For 65 years, the South Florida Hospital and Healthcare Association has made valuable contributions to the health of the communities that are South Florida.
65 years is truly an amazing feat by the association, and it just goes to show you that healthcare is organized and trying to do the best for the community. So 65 years of trying to help the community is great.
I wish you a very happy 65th anniversary. I'm only 3 years younger.
Happy 65th anniversary.
Felicidades en el aniversario número 65 a la Asociación de South Florida Hospital.
For 65 wonderful years, happy birthday to you.
Happy anniversary, South Florida Healthcare Association.
Well, happy anniversary to the South Florida Hospital and Healthcare Association. Now you can go on Medicare.